Do you experience pain and or tightness behind your knee? There can be a multitude of reasons why this happens, but as a physical therapist that specializes in helping people with arthritis, one of the primary reasons tightness can happen is muscle imbalance. So today I'm going to tell you the top 3 movements that can help you find relief right now. One caveat: if you have noticed a sudden or rapid onset of behind the knee pain, or it's associated with an injury like a fall, it's very important to go get it checked out to rule out some of the other reasons behind the knee pain can be happening. If you've noticed a gradual onset and increasing muscle tightness, then this is the video for you. Let's go. Now, muscles become tight for a reason. A lot of times it's your muscle searching for stability. If it doesn't have strength, it needs stability from somewhere. So sometimes those muscles then tighten up. This is why static stretching usually only helps in the short term. You have to keep doing it because we're not fixing the root of the problem. You're trying to pull on a muscle that's tight for a reason. So in order to get to the root of that reason, one of the best ways to influence muscle tightness and reduce it is actually through movement. There's a reason we're going to be doing 3 separate movements. Each one of these movements I'm going to show you is focusing on a specific muscle group. The first movement we're going to look at is going to focus on the backs of your legs, also known as your hamstrings. These muscles come down and attach near the back of the knee. When you have tightness or you have an imbalance there, it can make the back of your knee feel tight. If we're looking to contract and relax the backs of your legs, one great way to do it is by lifting up your heel behind you. You're essentially trying to get it as close to your bottom as you can. As you do this, you'll feel the back of your leg tighten up, and then it will relax as you put your leg down. You're going to repeat this for about 5 to 8 repetitions at first. If you feel some muscle cramping, that can be an indication that there is some muscle weakness there, and this is something to work on. One way to modify this is to lessen the range of motion, so you're still getting that contraction, but you're not pulling it through the full range of motion. Moving down to your lower leg, your calf muscle also plays a part in back of the knee tightness. This muscle comes up and attaches near the knee and can influence your ability to bend and straighten. Exercise number 2 is now focusing on the calf muscles. You can do this one of 2 ways. Again, we're focusing on contracting and relaxing that muscle instead of just doing a static stretch. You can start by raising up onto your toes, and then you can raise your toes. So this is essentially a contraction where I'm using those calf muscles as I raise up onto my toes. Then I allow those muscles to lengthen and feel a little bit of a stretch there. Move it through the range of motion, aiming for about 10 to 20 repetitions of this, using support if needed. Another way you can do this is by moving to a single leg calf raise. Now this is going to be a little bit more of an advanced movement. Raise up on one foot, and then lift up on one foot. You can start with just the raise, as this will be a little bit easier. You can add in the toe lift once you feel more confident with it, as you will need a little bit more range of motion coming into this knee straightening. That one you can start a little bit lower, 5 to 8 repetitions, see how it feels. And lastly, one that's commonly forgotten is actually the inner thigh. Having some weakness or some imbalance there can influence the back of your knee. For exercise number 3, we're going to be working the inner thigh groin area. One of my favorite ways to do this is actually in a seated position using a pillow. Place the pillow between your knees, feet in a position where they're aligned with your knees, meaning you don't want to be in this position where your feet are outside of your knees. Now you're going to squeeze the pillow together. Hold for about 3 to 5 seconds and then relax. Squeeze and relax. As you squeeze, you should feel an activation of those inner thigh muscles. Again, allowing those muscles to contract and then relax, aiding in that long-term stiffness relief. Trying anywhere from about 5 to 8 repetitions at first, squeezing at about 50% effort. This isn't something you have to squeeze as hard as you can. You're just trying to elicit that muscle contraction. These 3 movements can be a great way to start reducing your back of the knee pain and stiffness. If you're looking for more tips to improve your joint mobility, reduce your joint pain, and make adventures possible, make sure you hit that red subscribe button down below. I'll see you in the next video.